Dr. Marisa Markey, and she's going to be opening up Pandora's box a little bit, and she's going to discuss scratches with all of you, which is a really confusing topic that we don't have all the answers for.
Thank you very much. So equine scratches or dermatitis that you see on the lower limbs of horses, this is actually one of the topics that when we were planning this event, we put it out on Facebook, what people wanted us to talk about, and scratches was one of those things that come up. So I am going to start with a disclaimer. I do not have a miracle cure for scratches. I'm sorry. Can you hear me now? Oh, there we go. I can hear me. Okay. So as I was saying, I have to apologize in advance. I do not have a miracle cure for scratches. No one does. So my goal over these next 20 minutes is to speak with you about what the different causes of scratches are, what our different diagnostic tools are, and then different treatment options as well. So scratches is also known as pastern dermatitis, mud fever, mud rash, grease heel, dew poisoning, and grapes. It's not actually a disease, but rather a skin pattern or syndrome that's caused by several different diseases that all look the same. Most characteristic, it's often seen in draft horses, mostly in adult horses. The hind limbs tend to be most commonly affected, and often it's the non-pigmented or white skin that's most commonly affected. The Merck Veterinary Manual defines it as a chronic, seborrheic or flaky skin dermatitis characterized by hypertrophy, which is enlargement of the skin cells, and exudation or oozing on the caudal or rear surface of the pastern and fetlock. So it's a fairly broad description. We can break it down a little bit further. So we have our mild form, which is when we see hair loss, dry scales, and crusts. It's a little bit variable in that the skin can be thickened. Some horses are itchy, some horses are painful, but not all. And then our next step up is our exudative form. So that's when we start seeing redness or erosion and hair loss. We also start to see more crusting and or serous and purulent discharge, as well as swelling of the blood vessels, which we call vasculitis. Again, that form can be painful or itchy or neither. And then this is kind of the worst of the worst. So we're looking at our chronic proliferative form. It's most often seen in the draft horses, and it causes excessive granulation or healing tissue that then becomes cortified or hardened like a scab. And in this case, fissures may develop, so those are breaks in the skin because this is such a high motion area, and that can also be a very painful problem. So when we're looking at scratches, we have to think about why do horses get this. So we have our predisposing factors, our primary factors, and our perpetuating factors that can complicate the whole issue for each individual horse. So our predisposing factors that we look at is we do have genetic factors, so non-pigmented skin and hair on the lower limbs, so white limbs. Draft horses in particular are unfortunately quite prone to this. Feathers on the pasterns, which goes hand in hand with being a draft horse, and any keratinization disorder or skin disorder that is genetic. We also have our environmental causes that most people do know about, so climate and level of moisture, poor stable or pasture hygiene. Alkaline soil can be a predisposing factor, as well as sand, especially in Arabian horses for some reason. And then our iatrogenic causes, so caused by people, irritating topical products that we may put on their skin or training devices. And then we look at our primary factors. So what is actually causing the skin irritation and the signs that we call scratches? So we have our physical or chemical irritants. So again, blistering of the skin, things like creosote or motor oil, and often treated bedding or shavings can cause problems. We also have our immune-mediated causes, so any sort of contact allergy where the horse's immune system is reacting to something on its skin, photosensitization, so when they're reacting to UV lights, vasculitis, and then the final one is the pemphigus complex, which is an immune complex where the body is depositing different molecules that again cause skin irritation. We also have our infectious causes, so our bacteria and our fungus. We have parasites and neoplastic or cancerous causes that can again cause skin issues. And then we have our perpetuating factors. This is why, even though we may be treating that primary cause properly, this is what is going to make it not go away. So we have our bacterial infections that as soon as they find a break in the skin, they set up shop and have a party. We also have pathogenic skin conditions, so insect bites can be a real problem, or trauma. Either self-trauma that the horse is causing to themselves, or sometimes trauma that we cause when we're picking the scabs and trying to help, but maybe not really helping properly. And again, environmental causes. So our UV exposure, our level of moisture, and extreme cold can all be perpetuating factors. So let's delve a little bit deeper into the different primary factors or primary causes. I tried to break these a little bit into what we would see on the skin when we have this primary factor. So first we have crusts and scaling, but without any itchiness or pruritus. So that's when we're talking about bacterial infections. So we have two main bacteria that love to live on the skin and just wait for their opportunity to get in and cause a problem. We also have our fungus, so dermatophytes is the fancy name for ringworm, and that's a fungal infection that can get in and cause a problem as well. And then we have our contact reaction. Some horses can be very sensitive to a soap that we use quite frequently, chlorhexidine, also known as butane, as well as other things such as tea tree oil or treated shavings. All of those can cause irritation to the skin and crusting and scaling. And then when we start talking about crusting and scaling with pruritus or itchiness, this little monster is generally the main problem that we see, and it's mite or horioptic mange. It's mainly seen in draft horses. The heavy feathering really predisposes. They like to hide in that heavy feathering, and it's usually seen in the winter months. These horses are extremely itchy and will often show stamping of their feet. And it's also very contagious, so you usually see more than one horse in a herd affected. And then we start talking about only the unpigmented or white skin, which I'm sure most people have seen quite frequently. So one thing we think about is photosensitization. So that's when they're reacting to the sunlight. And this can either be from something that's bloodborne, working its way out to the skin, or something by skin contact. So when we're talking about bloodborne problems, we're looking at certain plants, such as St. John's wort or Alsite clover. Some drugs can cause this as well. And then liver disease, whether the liver disease is caused by ingesting something or a primary liver disease, that can also cause photosensitization of that white skin. And then also skin contact, so irritating substances that can cause photosensitization include tar, again, plants like giant hogweed and wild parsnip, clover, including some sunscreens and some antiseptics. So hopefully everyone knows these and they're looking for them in the pasture, but once again, we have our St. John's wort, Alsite clover, giant hogweed, and wild parsnip. Continuing on with the white skin, another problem that we can have is, again, the vasculitis or swelling of the blood cells and blood vessels. Again, mainly affects unpigmented skin, but in this case, we can also see the pigmented skin affected, but usually not quite as severely. And these lesions are usually quite painful for the horse. They don't like having it touched, and it's more often found on the inside and outside of the leg as opposed to the back of the leg. So that's one way to differentiate it as well. And continuing on, so when we're starting to see nodules or proliferative lesions, so kind of scabs growing on scabs, growing on scabs, any long-standing pasturean dermatitis has the potential to turn into something terrible like this if left untreated. However, in this case, this is a case of chronic progressive lymphedema, which is found in draft breeds. It's actually a genetic defect in elastin and hinders the lymph vessels, so the leg is unable to get extra fluid out of it. These horses originally show swelling, skin folding, ulcerations, and progress to something like this. So with all of those different causes, how are we going to determine what it is each individual horse has? They can have a handful of any predisposing cause, primary cause, or perpetuating cause. So when we're talking about diagnosis, we have quite a few tools in our tool chest, and the question is, how do we pick which ones we want to use? So really, really, really important in our diagnosis is a thorough history and looking at the horse really carefully. There's a lot of important questions that we're going to want to ask you to try and determine which way we want to go. So what age did this start? What month of the year did it start? And does it appear to be seasonal or not? Is it itchy for the horse or is it not? We're not naive. We know you guys usually try something before you call us out. That's fair. So we want to know what you have used, medication, ointments, soaps, and have they improved things? Have they made them worse? Or is it just staying the same? We're going to look really closely at their environment and ask you about the history of their environment, different bedding they're on, pasture, sand, the amount of insects that you have around, as well as the moisture in the environment. And again, are there any other horses infected? Because we do have some causes that can be contagious. And also, are any humans infected? So this is sometimes things that your horse can spread to you. And so if you're having similar lesions, that's really going to help us narrow it down. So what are the different tools that we may reach for? One is a superficial skin scraping. So when we scrape the edge of the lesion with something sharp to take off the top layer of skin cells and whatever might be lingering there, and then looking at it under a microscope. It's a great way to rule out those mites. You can't see them with your eye, you have to see them under the microscope, but we can often get them on a superficial skin scraping, and if we see them, we know how to proceed. Another way to do this is called an adhesive tape impression. So again, we're just taking a really sticky piece of tape, taking off that top layer of cells, and looking at it under a microscope. So we're looking at this point for bacterial infections and what type of bacteria we might be dealing with, so we know what kind of antibiotic we might want to treat with. Another option is a biopsy. It's a little more invasive, and this is often something when we've tried several treatments and we're not getting the success that we would like to see, then we go to something like a culture of a biopsy. So we take that chunk of skin, send it to the lab, and they try and grow whatever bacteria or fungus is sitting on the skin, so we know again what to treat. Another method we have is simply examining hairs. So plucking hairs out of the edge of a lesion and looking at it under the microscope can be a great way to spot ringworm. The ringworm likes to attach itself to hair shafts, and we can see those under the microscope. While we have ringworm on the brain, we might also talk about doing a culture. Fungus is a little bit harder to culture than bacteria is, so we're looking at kind of a 7 to 10 day turnaround for a result, but that can also be quite satisfying when we know what we're treating and we can treat it directly. Another option we have is something we call cytology. So again, just looking at cells under the microscope. So we can either take a swab from the scratches lesion and put that on a microscope slide, or even take one of those crusts itself off and crush it onto a microscope slide. That's a great way to check for what type of bacteria or fungus could potentially be in there. And another way to use a biopsy is again for microscopic examination. So we take a biopsy, send it to the lab, they put it under a microscope, and they can see the different kind of cells that are there. This is a great option, again, if we've treated several times and we're still not getting the success we would like to see, or if we're starting to wonder if this is an immune-mediated problem, so the horse's immune system itself is causing the scratches, and we would see certain cell types in that case that we could then treat. And finally, we have our complete blood count. So like I mentioned earlier with photosensitization, sometimes liver problems can start to make the unpigmented areas of the horse very sensitive to sunlight, whether that's a primary liver problem, like a bacterial infection in the liver, or secondary to eating one of those plants. We will see that in their blood work as liver damage and can again treat appropriately. So those are all of our diagnostic tools. We're not going to use all of them. Like I said, your history and looking at all your predisposing and potentially perpetuating factors are going to really help us narrow down which of these tools we need to use. And once we have looked at those tools and tried to make an accurate diagnosis, then we can start talking about treatments. As everyone knows, there's probably 1 million products on the market that are all claiming to be the cure for scratches. And as you can see, there can't be one cure because no one piece of scratches is ever going to be the same. They all have different causes and they have different factors that are going on. So what can we recommend? Often we do have environmental recommendations that can help most horses. So keeping them out of pastures with mud, water, or sand, as these can predispose or worsen a case of dermatitis. Keeping them in clean, dry stalls during wet weather. Again, this is all easier said than done. Not releasing horses into the pasture until the morning dew has dried up. If we are starting to suspect a contact allergy, so often we would see all 4 limbs affected, then we want to start looking at that environment and do we need to change their bedding, or their pasture. If they have heavy hair feathers, we do suggest clipping those feathers, not with a super sharp blade that's going to go right down to the skin, but taking enough off that we're reducing that moisture retention around the area that's affected. And if photosensitization is suspected, so we're seeing it mostly on white skin, then we're going to talk about protecting that skin either by applying wraps or changing your stabling to turn out at night and keep in during the day and those sort of things. And then what are our options for actual treatments? So if we suspect a bacterial infection, either a primary or secondary bacterial infection, then we're going to talk about topical antibacterials for the most part. So antibacterial shampoos are a great option, using that once or twice a day, usually for quite a long time, so 10 days or more, and then continuing with decreased frequency for several weeks. And regardless of that topical therapy, you really need to protect that area and make sure it's staying nice and clean and dry. There's a lot of ointments out there that have good penetration into the skin layers, and there is active research in this area. Clipping and cleaning, again, are important with any ointment. Nothing you buy is going to work if you just slap it on a wet, dirty leg. Antibiotic medications, so if we have to go as far as putting a horse on a systemic antibiotic, if the bacterial infection is quite severe, then they often do need a longer course of antibiotics, up to 3 weeks. And we're using that in conjunction with our environmental changes and topical antibiotics. Then if we're thinking we have a fungal infection that we're dealing with, especially ringworm, then a lime sulfur dip is usually quite successful. Or we do have other antifungals that we can put on topically to try and kill that fungus. In the case of parasites, so especially mites, choreoptic mites, we treat normally systemically with an ivermectin, so an antiparasitic, for a course of 4 weeks, once weekly. And this might need to be repeated because these mites are skin feeders. They don't often get very much blood, and so it's hard to get concentrations that are going to kill them. Going through what people have reported, we do have some other antiparasitics that you can put on topically. None of them are labeled for horses. However, they have been used successfully and safely to kill mites on horse skin. So we do have some options with that. Especially when treating mites, you want to make sure all the affected and contact horses are treated because they can harbor the mites. And mites can live off of a horse for up to 70 days, so you have your work cut out for you, decontaminating pretty much everything. Your barn, your stables, all of your tack, all of your grooming supplies, everything is going to need to be decontaminated. And then we get into the steroids. So steroids are something that essentially tell the body to slow the immune system down. So we don't want to use steroids unless we're sure that we do have an immune-mediated problem, because as you can imagine, if we tell the horse's own immune system to stop fighting in the face of a bacterial infection, things are just going to get worse. So we're talking about using it in these immune-mediated conditions or allergies where we have an overactive immune system. And we have things like steroid sprays or leave-on conditioners that have been used quite successfully. Systemic steroids, again, for immune suppression, can be used to treat immune-mediated conditions such as photoaggravated scratches or dermatitis, and that would be a decreasing course of steroids. And often those horses do need to be maintained on a very low level of steroids throughout their life to keep the pasturean dermatitis at bay. And dexamethasone or prednisolone are usually our kind of go-to steroids that we use in those cases. So those are our general treatment options. It's not a huge wide array. A lot of the ointments and salves that you have out there are really similar to each other, and we have to pick the right ones for the right horse in order to see success. A couple of interesting areas that I did want to touch on are the new research in this area. We know how frustrating it is. We're just as frustrated as horse owners in trying to treat these conditions, so we are continuing to look into them with research. One in particular is this chronic progressive lymphedema that's seen in the draft horses. Researchers at the University of California, Davis have been looking into this quite thoroughly. So, like I said earlier, it's found in draft breeds, and it does have a genetic component to it. It shows this progressive swelling, nodules, and fibrosis of the lower limbs. These changes are really similar to a condition in people, chronic lymphedema or elephantiasis. And they've proposed that this condition is caused by this genetic defect that results in a malfunctioning lymphatic system. They're studying different treatment and also genetic tests so that these horses that are potentially carriers of the disease can be taken out of the breeding population. So if you do have draft horses with this problem, there may be hope in the near future. Another really exciting area of research is what is coming out to be called the Scratches vaccine. So the name is the Insol dermatophyton, and as you can see in the poster, it's being studied in Europe, primarily Germany, and it's being developed to treat ringworm infections. So that is what is in the vaccine, are components of the ringworm fungus. It's been shown to successfully resolve those dermatophyte or ringworm infections with faster healing time, and also was used successfully in one stud farm when all other normal treatments have failed. So it's a really exciting possibility that we may have this vaccine that can help us out. The most exciting part of all of it is that some professionals are starting to propose that the vaccine itself alters the immune response and can be used in non-ringworm type scratches. So that's another area that gets us really excited that potentially we could use this for more than just ringworm problems. Unfortunately, the vaccine isn't currently available in North America. As a clinic, I think we've been able to get it a very small handful of times for cases that we felt were appropriate, and we are seeing some success. There are trials being conducted. Dr. Archibald in Edmonton is planning to do a trial in Alberta, and if you feel that you do have a horse that might be a candidate, you can apply on his website. I will caution that, like I said at the start, there is no one magical cure to scratches, and I don't think this is going to be it either, unfortunately. There are too many different factors that are involved in each individual horse's dermatitis or skin problem for any one cure to save them all. However, it is a really exciting thing that we could be looking into. So hopefully you understand why we are just as frustrated as you guys are and why your horse's scratches won't go away. But we do have diagnostic aids and we do have different treatment options that we can try, and we're willing to definitely work with you on that. So that is all I've got for today. I'm kind of scared, but are there any questions? Go ahead.
Are you guys aware at all of the research that was done in England by a company called KDF99 that developed a brush that had properties that killed the viruses that cause scratches? They developed it in England and it actually won scientific awards there. I used them on a horse that had scratches so bad she was lame, and I haven't had any problems since. So
Interesting.
I would certainly recommend them as a first step for a mild case to anybody who's got them. Fabulous brushes.
So for those of you in the back, the question was regarding a brush that was developed in England that targets viruses that can potentially cause scratches that have been used with success. I have not heard of that. And again, I would caution that I'm really happy it worked in your horse's case. It might not work in all of them, but it's definitely something we'll look into, and interesting to see if it is coming over to Canada. Yep, go ahead. Sorry, I missed the last bit. Yep, so we can absolutely take that biopsy sample on farm. So the most important part is getting the area nice and clean before we take the biopsy, so we do want a clean place to work and make sure everyone's nice and safe doing that, but that is something we can do on farm or in clinic. Yep, go ahead.
You recommended scratches. 7 years ago, I bought this horse and he really badly infected with scratches. What I did was I soaked his feet and then I took the scratches off manually. I mean, they were quite red after a while, but now I see that he's got it back again. But is that a recommendation to wash really well and pick it off? Because that's what I did.
So the question is whether or not you should be picking off those scabs, and I would advise you not to in the initial phases, because essentially what you are doing is opening the door for the bacteria that's in that scab and in that area to get into your horse's bloodstream and tissues in that area. So I would advise you instead to first clean it really thoroughly and wait until those start to come off on their own, and at that point you can start I would wash it at least once or twice a day. Yep. Okay, we'll take these last two questions. We probably need to move along.
You mentioned the training devices could cause them. What kind of a training device?
So if you've seen the Horse Protection Act news that's been in the news, that's mostly what I'm referring to as soaring in gaited horses. So when you're using training devices to inflict pain on the lower limbs, that certainly can predispose them to breaks in the skin. And there was one more. Do antihistamines work? That is a loaded question. So there is research into using antihistamines in horses. They certainly don't work in horses in the same way that they work in people. And I would say that their use in this case would very much depend on if we do actually have an allergy component to the skin issues that we're seeing. All right. Well, thank you, everybody. I think we'll move